Hi, I'm Ashley Michael. I'm a student at ASU taking a class on HIV, AIDS, and society. And today we're going to do a little bit of a presentation about mother-to-child transmission, which I know is something that is concerning to all of the mothers in the room. We're going to talk a little bit about mother-to-child transmission of HIV, and then with that knowledge, we're going to go on to a little bit of preventative measures. Just know, everything we discuss today, this is a safe space. Any concerns that you have, questions that you have, everything is kept fully confidential by me. I ask that you keep everything confidential that's shared in this room, but if you can't do that, let everybody know so that they can keep that in mind when asking questions and sharing your thoughts. If at any time you have to use the restroom, just know it is right behind me and to the right, so if you ever have to use the restroom, you don't have to ask, you can just get up and go. This presentation is going to be about 5 to 7 minutes, so it's going to be relatively short. I'll try and keep that in mind, and if you guys have questions, please ask at the end. And just one last thing before we jump in, I just want to let all of you know that no matter where you are in the world, in America, outside of America, anywhere in the world, there is absolutely no cure for HIV, but we can prevent it and we can treat it. So, moving on. We'll get started with mother-to-child transmission. There are 3 ways that a child can get HIV from their mother, and it starts off all the way with breastfeeding. We'll get started with that. Now, in the last little bit of the presentation, we talked a little bit about the fluids and the doors that spread HIV and allow it to be brought into the body from an HIV positive person to an HIV negative person. So we'll get started off by talking about breastfeeding. That's a very common concern for mothers. Now, there are 2 fluids involved in this process of spreading HIV from mother to child. 2 of the fluids we talked about last time are breast milk and blood. Blood is especially prevalent during the process of teething, which happens about 6 or so months in. A lot of mothers like to look out for that, but even beforehand, it is still 100% possible for a mother to spread HIV to her child without having any teething involved. Now, the reason this is because of one of the 4 doors that we talked about of open wounds. You'll notice that earlier we talked about talked about how the door of the mouth is not actually a door at all. That's an entire misconception. However, the mouth, especially of infants and young babies, have a lot of microlesions in it as a result of teething. And so, as a result, the mouth acts almost kind of like a door, especially due to breast milk and blood, which can spread HIV through these open wounds. Moving on to the second form of HIV transmission from mother to child, it happens during delivery. There are 2 fluids involved, vaginal secretions or vaginal fluids, and blood. During delivery, there's a lot of both involved, which means there's a high potential for HIV to be spread from mother to child, specifically through the same door that we talked about just now of open wounds. A lot of lacerations happen when the baby goes through the birth canal. There is a very high potential that HIV can be spread from mother to child, whether it's through vaginal fluids or blood, and especially because there are 2 fluids involved, it raises the chances even more that the baby can contract HIV during delivery. The final way that a baby can get HIV from its parent is in the womb. Now, this is a very, very rare form of transmission. It's not observed very often, but it has been observed and it is possible. It is spread through blood, which, while normally there is a bit of a barrier in between mother and baby that would prevent this spread, if that barrier ever gets broken, the placental barrier, then it is possible for blood to get through, blood from the mother to the child, which would cause the spread of HIV due to open wounds, which again acts as a door. Now, really, there aren't a lot of ways that this is going to happen. The placental barrier acts as a very, very strong barrier for the baby. However, in cases of poor nutrition and in cases of assault, accidents, or domestic violence, it is 100% possible that that break can happen and that the spread can occur within the womb. Now, talking a little bit moving forward about now that we know how it can be spread, we should know a little bit more about what we can do to prevent it. So, the #1 most common treatment for HIV prevention is antiretrovirals, also known as ARVs. There are numerous options available. No matter what your income bracket is, you can talk to your doctor, you can talk to your pharmacist, find a way to get yourself on antiretrovirals. Traditionally, you would be tested early on in the pregnancy, and then antiretrovirals would be prescribed several weeks before the baby is actually delivered. This would lower the amount of HIV present in the blood significantly and in all other fluids, which lowers the rate of transmission. It would lower the rate of HIV pretty much to a level where it's undetectable. And as we talked about earlier, undetectable means untransmittable. This is able to prevent the spread of HIV through methods 1, 2, and 3. It It can't be spread during breastfeeding, it can't be spread during delivery, and it cannot be spread in the womb, as long as antiretrovirals are consistently taken by the mother. The next best thing that you can do, the very first thing that you can do before all of you even got in here, all of you should have been tested for HIV. The United States has suggested for the CDC that there is an opt-out program for testing for HIV, meaning that naturally you're already going to be tested pretty much every single visit that you go in, but you can choose to opt out. But the best thing that you can do as a mother to protect your child is to get tested for HIV and to know your status at all times. If you have any partners, you should also immediately get tested as well, just to know what your status is. They can never know to put you on antiretrovirals if they don't know that you have HIV in the first place. And you will never know if you can spread it to your child if you don't know what your status is. By knowing what your status is and knowing if you're HIV positive, you can prevent the spread of HIV through methods 1, 2, and 3 again. The last thing that I'm going to recommend to all of the mothers out there is that one of the best things that you can do, at least for preventing womb transmission of HIV, is talking to your doctor about having a proper nutrition and a proper diet during the process of pregnancy. Having a proper set of nutrition in place will mean that you lower your risk or chance of breaking the placental barrier, which means that blood is not going to get through. Blood is not going to transmit HIV to your baby. It's one of the best things that you can do to make sure that you can avoid risk number 3. Now, do we have any questions?
I have a question.
Yeah.
If I'm HIV positive, can I still breastfeed?
It is 100% possible to breastfeed. One thing is that you can take antiretrovirals. It means that breastfeeding is still 100% possible. Now, as to whether you choose to breastfeed or use a wet nurse or formula, that's something that is 100% talk to your doctor about. I am a college student. I am not a physician. It is in your best interest and everybody's best interest here to talk to your doctor. Your doctor knows about HIV. Your doctor knows about HIV transmission, and your doctor is going to know you best as a patient. And so they're going to know whether it's going to be better for you to go on formula, to have a wet nurse. That's not in my judgment to say. Any other questions? All right. Thank you guys so much. It was good talking to you. If you have any questions, you can come up to me afterwards. Thank you.